Welcome back. In this video lecture module, we're going to talk about the evolution of pharmacy practice. In a previous module that was talking about what is pharmacy, we discussed several trends that happened over time in terms of kind of a bigger look at more of a 30,000 foot view, as I said it, and look at pharmacy's evolution. In this module, we're going to think more specifically about American pharmacy, and we'll drill down to the 20th and 21st century. And you know, in those trends that we looked at previously, we said that fundamentally pharmacy has moved from a product orientation to more of a patient orientation. And we'll see how the ramifications of that have played out in American history within the last 100 years. These changes that we're about to describe in terms of the evolution of pharmacy practice really paralleled changes that were happening in education as well. And we will learn a bit more about the educational pathways in this field next week, but you'll see similarities in how we train students and then how this practice evolved. Maybe that makes sense. Well, the first recorded evidence that we have of a community pharmacy, if you will, known then as an apothecary shop in the United States, was William Davis in Boston, who opened an apothecary in 1646. And then in terms of hospital practice, we have records of Jonathan Roberts, who was, we think, the first hospital practitioner at the Pennsylvania Hospital in 1752. You know, there have been lots of really serious changes in these practices since these men opened these practices. They would probably be pretty shocked to see what things have evolved to today and some of the evolution of the practice that we're going to talk about in the next few minutes. Well, let's think about how this landscape began to change in the United States. And certainly in the 19th century, we began to see the kind of the classical American drugstore. You know, the corner drugstore, typically owned by, you know, independent practitioners. You know, they, by the way, in those days, the average dispensing was about 8 prescriptions per day. They often had soda fountains where they would serve food. It was kind of a community gathering place. And they still compounded most of the medications at the turn of the 20th century. But between 1901 and 1927, a man by the name of Charles Walgreen, and I'm sure you recognize that name, opened 116 drugstores in the Chicago area, which started really the first big chain pharmacy. This, as we talked about earlier in What is Pharmacy, started to fundamentally change where pharmacists practice. Started to shift away from maybe being more independent pharmacy owners, more toward working in these chain pharmacies or in other such venues. I want to also think about significant movement in the 20th century around clinical pharmacy. And you know, the terms that we will use are kind of interesting. The phrase clinical pharmacy was kind of all the rage in the late 20th century. Now we talk about MTM, or medication therapy management. We talk about the patient-centered medical home, collaborative practices. So, you know, clinical pharmacy is maybe not so much in vogue. But there was a clinical pharmacy movement in the 1960s in the United States, and this was anchored primarily in hospital practice. But we started to see things, and these are pharmacy fundamentals you see listed here, things like unit dose systems, IV admixture systems, and formularies that we'll describe here in a few minutes. But also pharmacists doing different things. You know, pharmacists started to go on rounds with the physician teams. They started to work outside the dispensing area and satellite areas, and started to have more of kind of a patient-centered or collaborative practice orientation as early as 1960. These things were happening in hospital practice. And you know, I'm sitting here in my office at Ohio State, you know, maybe a quarter of a mile from our big medical center where we have a huge hospital operation. And, you know, I actually practiced in that medical center for a while. And, you know, those changes in hospital practice happened really the last 50 years of the 20th century, all these changes to clinical practice. And they're still growing, but they are clearly there. What's happened in community practice? And I want to point out to you that about the same time this clinical pharmacy movement started, a man by the name of Eugene White in Berryville, Virginia, opened a pharmacy. You see pictures of it here on the slide, where it was an office-based community pharmacy practice. Kind of reminds you maybe of an apothecary shop, doesn't it? That we talked about in our pharmaceutical beginnings. Well, Mr. White had the vision that, you know, this would be much like going to a physician's office, and we would have patient consultations, and we would keep records, and we would follow up with patients, and we would really try to monitor their drug therapies and help them take care of their medications while they are at home, not in the hospital. We'll see that those beginnings that Eugene White created in 1960 are changing even yet today. And it's my contention that our practices of community pharmacy in the United States are really undergoing rapid change as we speak. While changes in practice were happening in the 20th century, both in the community side and especially in the hospital side, there were also changes happening to how we pay for drugs, and how we contain costs, how we use formularies. It's kind of the business model, if you will, of medical practice. And we saw this thing called the Health Maintenance Organization Act of 1973, which helped drive that. You see Health Maintenance Organization as a pharmacy fundamental for us. We also call these HMOs. And by the 1990s, about 2/3 of Americans were enrolled in some sort of an HMO, and that has continued to grow since then. In the 20th century, maybe to my way of thinking, the most single significant thing, the biggest thing of significance that happened was when Doug Hepler and Linda Strand described what they called pharmaceutical care in 1989. This they described as the responsible provision of drug therapy for the purpose of achieving outcomes that improve a patient's quality of life. Pharmaceutical care. Not such a popular word these days, kind of historical significance. Now we think of medication therapy management. As you see on the slide, we're going to describe that to you in more detail later on in the course. But the idea that this was patient-centered, that it was outcomes-oriented, and that pharmacists were responsible was kind of the three-legged stool of pharmaceutical care, if you will. And it started moving pharmacists very significantly away from just the dispensing role to, are we helping patients get the best outcomes from their therapy, which is really the mantra for the future. And that has evolved into what we call medication therapy management today. We'll talk about that more later on in this course. Other kind of significant trends in the 20th century is that we started to see less pharmacist compounding of medications. At the beginning part of the 20th century, most medications were still compounded. By the end of it, only 1% to 2%, and that holds today. We started to see a shift in the kind of the gender mix in pharmacy and a significant increase in women practitioners in this field. And that has continued to evolve as well. Today in our pharmacy program here, as across the country, somewhere between 60% and 70% of our students are women. So that gender shift has happened in a significant way. And obviously in every aspect of our lives in the 20th century, we saw large increases in computerization and automation around about everything we do in our lives. Certainly happened in pharmacy as well. So the idea of using computerized records, of using robotics for dispensing, and all the things that we'll talk about even later on in this course as well, happened throughout the 20th century and evolved during that time. And finally, the use of supportive personnel or pharmacy technicians really grew in the 20th century, to the point where we now have national certification for technicians that help pharmacists do the work that we do and to work together to make that happen. We're going to learn more about pharmacy technicians later on too, and we'll understand more about what that means. So let's review quite a few pharmacy fundamentals for today, and they're significant ones with big long descriptions, and I apologize to you for that. The first one of these is the concept of unit dose. This means drug distribution systems which utilize single unit packaging, one dose in one package with label identification on each dose. So we've got one tablet in one package with a label on there telling us what it is. These systems improve medication safety because the drug can be identified until administered to the patient. And it can produce cost savings as well because we can sometimes reuse these medications when they're returned to the pharmacy. Unit dose. Let me tell you a sidebar here in terms of another definition. We'll also hear about unit of use packaging. So unit dose means one tablet, one package, one label, identified till we give it to the patient. Let's think about unit of use, which means manufacturing quantities of doses that are typically used in a standard prescription. So instead of giving you a big jar of 1,000 tablets of something, they might package these in packages of 100 or 30 that are the typical amounts dispensed. Unit of use packaging. Very common in Europe. Those of you who are watching this from Europe understand that. Not so common here, but growing. Next pharmacy fundamental is called IV admixture. And this means the sterile preparation of a small volume of intravenous fluids. Intravenous means I'm going to put it into the vein, containing medications for patient administration. These medications are usually piggybacked by administration through an existing IV fluid line. So typically what happens is a patient would have an IV flowing sometimes into a vein in the arm or other parts of the body, slowly dripping maybe a saline solution into the patient, and then we would prepare a medication in a smaller fluid bag and put that through that same line and administer it to the patient, an IV admixture. A little piece of history that I'll just talk about our place. Here I am at Ohio State University. The very first use of many bottles for use in these IV admixture administrations were used on this campus under the leadership of a man by the name of Clifton Lachelet. The next pharmacy fundamental is the word formulary. So, you know, in an earlier video recording we talked about pharmacopoeia, which was a kind of a complete listing of drugs, standards for their preparation and their use. A formulary is akin to that pharmacopoeia but different. A formulary is a listing of medications approved for use within an institution or covered by a third-party payer. Hospitals typically appoint a Pharmacy and Therapeutics, or P&T, committee to select medications for this formulary inclusion. So this means if I walk across the street right now to the University Medical Center here at Ohio State, they have a drug formulary of drugs that they will store in their pharmacy and use in their patient care. That means they're not going to keep all drugs. They're going to select the ones that they think are best, maybe more cost effective, and these are the drugs we will use. If the prescriber wants to use other drugs, they can, but it's much more difficult, and it's certainly made easier if you use formulary products. And you know, things like Medicaid, Medicare, insurance companies all have their own formularies of drugs they will cover, and this is what that concept refers to. We talked about the concept of pharmaceutical care as a pharmacy fundamental created by or introduced by Hepler and Strand in 1989-1990. They described this as the responsible provision of drug therapy for the purpose of achieving outcomes that improve a patient's quality of life. But think of pharmaceutical care as moving from product orientation to patient orientation. And here's a big long one. Health Maintenance Organization, or HMO, a type of health insurance plan that usually limits coverage to care from doctors who work for or contract with an HMO. The HMO generally won't cover out-of-network care that's using different physicians or healthcare facilities except in an emergency. An HMO may require you to live or work in its service area or to be eligible for coverage, and HMOs often provide integrated care and focus on prevention and wellness. It's really to help us stay well, but also to help us save money. Well, we're through with all those lengthy pharmacy fundamentals, and here's our last slide. I want to think about a question I'd like you to consider as you go into the discussion forums after this video. And that is that Eugene White had a vision for a different approach to community practice that he introduced in 1960 in Berryville, Virginia. What is your vision for how community pharmacists may practice differently in the years to come? So tell us what you think, share your thoughts, and we'll see you next time.